Hello, this is Dr. Drew Hall from Los Angeles again. What we want to talk about today is chronic fatigue syndrome. Now, chronic fatigue syndrome 30 years ago was thought to be people were just hysterical. It was all in their head because lots of tests were run on these people and they couldn't determine what was wrong with them. In fact, today there's still no good blood or other type of test to nail down exactly what chronic fatigue is. And having been someone 23 years ago who suffered with chronic fatigue, I'm here to tell you there is no one discipline that has all the answers for every chronic fatigue case. I think chronic fatigue syndrome is a multifactorial problem and needs a multifactorial approach. What I want to talk today about is upper cervical care, and that's how the upper cervical spine relates to your health and how people with chronic fatigue syndrome and fibromyalgia for that matter can be helped by receiving precise upper cervical chiropractic care. So first I just want to talk about chronic fatigue kind of its onset. Most people who suffer with chronic fatigue syndrome had some episode. Usually they get sick, they get a flu, they get a sinus infection, something happens where they get sick and then they never recover. And so that's the first thing I want to talk about. Why is it that people with chronic fatigue get an illness, a viral infection, some sort of viral or bacterial infection, and then their body is never able to overcome it and become well? Why is it that one person can be around them and they have a virus in their system that they can't get rid of and the other person doesn't get sick? So this gets kind of down to a philosophy. And what I'm trying to get through is there's got to be, it's not the virus, it's not the bacteria, there's got to be something that's weakened the system, weakened the body, and the body isn't strong enough to overcome what's making the person sick. So that gets back to old aged question called, is it the seed or the soil? Is it the bacteria, is it the virus, or is it the body is too weak to overcome? And so my own personal story, I was dropped on my head when I was 17 wrestling, which at the time I didn't think was a big deal. But over time I developed all these bizarre symptoms, and about 6 months after that I developed a sinus infection, which made me really sick. I mean, to the point I couldn't go to school, and it never left me. And so the next 2.5 years my energy was absolutely shot, and I developed 20 other different symptoms, and I never felt well. I was nauseated all the time. My body ached from head to toe. I no longer could exercise, and if I did anything that exerted myself, it caused a serious backlash. And so in my particular case, I initially got to a homeopathic doctor who put me on a pretty stringent diet, and I started juicing, and I cut out sugar and white flour, and I started supplementing. Actually a pretty avant-garde homeopath at the time that put me on a leaky gut type protocol back in the 90s, which was probably the beginning of that idea in the Candida protocol. And it made a difference. It did. But it certainly wasn't the whole kit and caboodle for me. And eventually I was referred to an upper cervical doctor, Dr. Tom Forrest in San Francisco Bay Area, and he corrected my upper cervical spine. So what I find in my clinic, people who have chronic fatigue and fibromyalgia, it's a similar story to what happened to me. And they've been generally to 10 to 50 doctors, and they've done all sorts of diet modification. You know, they've done the leaky gut protocol and the Candida diet, and they're taking supplements, and some of them are juicing and massage, and they've done a lot of, they're going to a functional medical doctor, and they've had all their blood work. But most of them are missing one of what I believe is the key components. And one of the key components is your atlas. Your central nervous system controls and coordinates every function in your body. Every cell in your body is told what to do by a neurological impulse that goes from the brain down through the spinal cord, out a nerve to the tissue, right? And so most of us through life have had some sort of injury that's caused the C1 to dislodge and lock under the skull. Head weighs 10 to 12 pounds, C1 weighs 2 ounces. It's a very unstable junction. And so what I find with these chronic fatigue and fibromyalgia cases is once we run tests and find out that they indeed do have a C1 problem, We take precise x-rays to find out exactly what direction is off. And then we make a precise correction to fix it. And then over time, we have objective tests that monitor them to determine, are they where they should be, or are they misaligned again? Our goal is to keep them clear as long as possible so the central nervous system can function as well as it should. And many times, more often than not, once that atlas is corrected, these people's lives start to improve. Now, I'll be the first one to admit, chronic fatigue syndrome especially is a very difficult condition to overcome. And it requires a diligent lifestyle, and it requires a team of doctors from different areas of expertise to help them get better. So if you're someone who's suffering with chronic fatigue syndrome, I'm here to tell you there are answers. Keep looking. I would highly impress upon you that you should seek out an upper cervical specialist in your area. If you're in the Los Angeles area, of course, we offer a free consultation exam. If you're outside of the Los Angeles area, you can get to Blair Chiropractic.com. It's got a list of doctors throughout the country. And then there's another one, upcspine.com, where you can find an upper cervical doctor in your locale. I hope this information has been helpful, and I wish all of you health and healing.